Welcome back. Today we're going to talk about a different area of the body. We've been focusing a lot on the hip and a lot of hip stretches, and now we're going to cover the knee. There are a wide variety of reasons why we might have knee pain. And while I can't go through all of them, just know that what we're focusing on is where the knee pain is and what we can do about it. Today's version, we're going to talk about pain that happens in the front of the knee. Sometimes it's called patellofemoral syndrome, it's called front of the knee pain, anterior knee pain, runner's knee. There's a lot of different words that all describe pain in the front of your knee. Granted, there are many sources of why we can have this pain. We're going to look at injuries related to knee pain just coming on gradually, not necessarily you fell on your knee and it swelled up. Now, one of the main reasons that we have knee pain is because our pelvis and our trunk position are off just enough that our muscles that attach to our knee pull it into a position that causes pinching. We've talked a lot about this on different body parts, but we have to really consider this as a problem. And I've worked with many different people, many runners, many athletes, many people who just have knee pain in general. And what we have to look at is the pelvic position. Now, if my pelvis is tipped far forward, now all of a sudden, and my back is arched, and we have an extreme lordosis or curvature in the low back, that changes the position of my body weight forward, and it goes on down towards the front of my knee. Now, when we do that, and our back is being used, and we go to move, what usually happens is our hip flexors become tight because they're the prime movers then of our body when we start walking. And the problem is our hamstrings learn how not to use. And we lose the ability to sense these hamstrings working when we go to walk. And so when you're doing activities or like getting up from a chair, you may have front of the knee pain because you have forgotten how to use these hamstring muscles in the back of your thigh. The other thing is you forget how to sense it and you forget how to use them. So what we have to do is learn how to activate those hamstring muscles again through different exercises without compensating through our low back. One of the big things that you can do is working on relaxing your back muscles so that your pelvis can turn under, kind of roll back a little bit. And so then when you go to step forward, you feel your heel strike and you feel the hamstrings start to kick in. That helps our pelvis get back into a neutral position. So if I'm arched like this and I can feel my low back relax so that my pelvis gets into position, and then my hamstrings are activated, it further gets my pelvis into neutral so that my weight goes down through the bones instead of over the front of the knee. It goes down through the center of the knee, and I can start to feel the weight now more towards the back of my foot, at my heel, and the arch of my foot. And a lot of times this can help you with front of the knee pain. Now, if that simple solution doesn't work or you haven't been able to find someone to help you implement activating your hamstrings and changing your pelvic position, there could be other factors, or you may need some one-on-one coaching through this. I'm available for one-on-one coaching to help you if you need more assistance through this, and we can do this virtually, where I'm looking at you and I'm giving you different exercises and working to calm down your nervous system. I also have plenty of videos online to help you as well through the breathing process, but sometimes you need an outside person to look and see, okay, where's the problem going, because sometimes it can be even higher up. I wanted to give you this information and just realize how valuable your hamstrings are, both for your knee and getting your pelvis in the correct position. If you have any questions, please reach out to me at amy@paberinstitute.com. That's PABRinstitute.com. Thanks for joining. Look forward to seeing you next week. Bye.